Hello, everyone. My name is Lauren Bouts. Today I'll be presenting on addressing water insecurity to improve mental health outcomes in the Navajo Nation using a climate risk and resilience approach. This presentation focuses on how water insecurity as a climate-related stressor shapes mental health and how public health interventions can address both immediate needs and long-term structural challenges. Climate change is a public health issue, and its impacts on water access have important implications for mental health and well-being. Water insecurity is not just about access, it is a chronic stressor that affects emotional, social, and psychological health. Its impacts extend beyond individuals, affecting families and communities and contributing to intergenerational effects. These impacts are not evenly distributed. Structural inequities and infrastructure gaps increase vulnerability in the Navajo Nation. At the same time, this presents a key public health opportunity to improve mental health by addressing water insecurity through a risk and resilience approach. The Navajo Nation is the largest federally recognized tribal nation in the United States, spanning parts of Arizona, New Mexico, and Utah. Around 170,000 to 180,000 people live on the Navajo Nation lands, which cover approximately 27,000 square miles. Estimates suggest that 15 to 30% of households lack reliable running water or complete plumbing, and many households rely on hauled water. Water, land, and people are deeply interconnected, and water holds cultural, spiritual, and practical importance in Diné life ways. This context is essential for understanding water insecurity as both a structural and public health issue. Water insecurity in the Navajo Nation is shaped by both environmental and structural factors. Historical underinvestment in federal policies have contributed to gaps in infrastructure and services. At the same time, drought, extreme heat, and changing precipitation patterns are intensifying water scarcity. Together, these factors create conditions where water access is limited, unpredictable, and burdensome. These are system-level issues that shape both exposure and vulnerability. For many households, water insecurity is a part of daily life. Estimates suggest that 15 to 30% of households lack reliable running water or complete plumbing, and around 40 to 45% rely on hauled water. Some households experience extended periods without running water and may pay significantly more per gallon than the national average. Day to day, this can mean spending time hauling water instead of working, attending school, or resting. It can also make it difficult to maintain hygiene, complete basic tasks, and manage health conditions. These challenges contribute to ongoing stress and uncertainty about water access. Water insecurity is therefore not just a service gap, it is a structural and environmental issue that shapes health and well-being. This conceptual model shows how climate hazards and structural conditions interact to influence mental health outcomes. Reading from left to right, climate-related hazards increase pressure on water systems. Structural factors, such as infrastructure gaps and economic constraints, shape how these pressures are experienced. These conditions lead to water insecurity, which contributes to stress and mental health outcomes. At the same time, protective factors such as community networks, cultural continuity, support resilience. This model helps identify where interventions can have the greatest impact. This intervention focuses on a key pathway, water insecurity as a driver of chronic stress. Limited or unreliable water access creates daily burdens and uncertainty, which contribute to stress over time. These stressors can affect mental health, well-being, and overall quality of life. This is the pathway the intervention targets. By focusing here, the intervention aims to reduce stress at its source while strengthening systems that support health. This intervention is designed to work in partnership with Navajo Nation programs and community organizations. Rather than creating entirely new systems, it focuses on strengthening coordination between water access efforts and behavioral health services. Key components include improving access to reliable water sources, supporting community-based outreach, and integrating mental health support into existing systems. This approach is community partnered and responsive to local priorities, recognizing the importance of community knowledge and leadership. The primary goal is to improve water access while reducing water-related stress and supporting mental health outcomes. Objectives include increasing access to reliable water, reducing time spent obtaining water, and improving coordination between water and health services. These objectives are measurable and designed to support longer-term system improvements. This intervention operates across multiple levels. At the household level, it reduces daily burden and improves access to services. At the community level, it supports local capacity and outreach. At the systems level, it improves coordination across water, health, and social services. At the policy level, it supports efforts to address infrastructure and funding gaps. Across all levels, the focus is on partnership, integration, and sustainability. There are potential barriers, including geographic challenges, infrastructure limitations, and resource constraints. Trust and historical context are also important considerations. However, there are strong facilitators, including existing community networks, ongoing water access initiatives, and community health representatives. Building on these strengths supports feasibility and long-term sustainability. Compared to more traditional approaches, this intervention takes a more integrated and systems-oriented perspective. It addresses multiple levels simultaneously rather than focusing on a single issue. It emphasizes partnership and coordination rather than treating communities as passive recipients. This approach supports more sustainable improvements in water access and mental health outcomes. In summary, water insecurity in the Navajo Nation is shaped by environmental and structural factors and is a key driver of stress and poor mental health outcomes. This intervention addresses water insecurity as both a practical and public health issue while strengthening systems and partnerships. Improving access to clean, reliable water supports health, dignity, and long-term well-being. My references are provided here. I am giving this presentation from Albuquerque, New Mexico, on the traditional lands of Pueblo peoples. This project centers on the Navajo Nation, where many Diné people live and continue to lead efforts to strengthen community well-being and resilience. I recognize the importance of sovereignty, lived experience, and community leadership in shaping public health approaches. Thank you.